Okay, so today we are going to discuss a male smoker die worker presented with the weight loss and grade 2 gangrene. What are the types of cell death? So, types of cell death are necrosis, apoptosis, and necroptosis. So, what is the necrosis? Necrosis is a form of cell death in which cellular membranes fall apart and cellular enzymes leak out and ultimately digest the cell. Necrosis elicits a host reaction called inflammation that is induced by substances released from the dead cells, or accidental and unregulated form of cell death resulting from damage to cell membranes and loss of iron homeostasis. So, if you want to remember the the definition of the necrosis, so you must remember that it's a damage to cell. So okay, so cell has outer coat which is called cell membrane, and the inner organelles, each organelle has also a cell membrane, contain a cell membrane. And this cell membrane, like, it's a very special membrane. It's, you can say, it's a sign of life because it maintains the inner and outer environments homeostasis. So necrosis is a form of cell death in which there is a damage to the cell membranes, or the cell membranes fall apart, and so there will be no homeostasis. There will be loss of iron homeostasis, and so the enzymes release from the organelles and can leak out and ultimately digest the cell, and that's why there will be a local inflammation as well in necrosis. So, what are the types of necrosis? So, basic types are coagulative necrosis, almost all tissues, and liquefactive necrosis, all qualitative necrosis, brain. Cases necrosis, tuberculosis. These are the distinct types. Fat necrosis in breast and pancreas, and fibrinoid necrosis and hypertension in the walls of the vessel, and gangrenous necrosis in diabetes mellitus. What are the nuclear changes of necrosis? So the nuclear changes are pegnosis and karyorrhexis and karyolysis. So what is pegnosis actually? So pegnosis is actually the shrinkage and increased basophilia. So remember that the cell uh, composed of nuclear chromatin in the nucleus, or DNA. So what are chromosomes? So what happens that karyopagnosis or pegnosis, it's the shrinkage of the nucleus. Okay, it's the shrinkage of the nucleus and increased basophilia. When the nucleus is shrinked and condensed, the basophilia, it always tend basophilic. And cytoplasm always tend eosinophilic. Eosin. Here you can see cytoplasm will be eosinophilic, and the inner cell will be basophilic. So it always, when it's condensed, so the basophilia will increase. So this is pegnosis, and pegnosis is the nuclear shrinkage and increased basophilia. The DNA condenses into dark shrunken mass. Then occurs the karyorrhexis. Rhexis means the fragmentation. So it will goes into fragmentation like this. Okay, and we will have the fragmented fragments of the nuclear material. Okay, and then we have the karyolysis, in which the basophilia fades because of the digestion of DNA by the deoxyribonuclease DNases activity. So they will fade out. Okay, so the nucleus will fade out and the eosinophilia will still persist. So this is the necrosis steps. Pathogens of necrosis: severe prolonged ischemia, severe swelling of mitochondria, calcium influx into mitochondria and into the cell with rupture of lysosomes and plasma membranes, death by necrosis due to the release. So actually the cytochrome C is the involved from the mitochondria. This is the main trigger of the necrosis. Death by necrosis due to the release of cytochrome C from the mitochondria, because the cell membrane will be lost of the mitochondria, so there will be disturbance of the internal and external hemostasis. So cytochrome C will be released and the cell will die. So define gangrene. And what is the other thing? The Apoptosis. Apoptosis is a programmed cell death. Okay, apoptosis is a programmed cell death, and it is a preventive mechanism. It is a uh, secures the body from damaged cells. So normal cell, okay, condensation of chromatin, membrane blebs, and cellular fragmentation, apoptosis. So the cellular contents are released in apoptotic bodies, and there is no local inflammation. And then phagocytose them. And here we have the recovery and the reversible injury. So if there is reversible injury, so there will be shrunken of the nuclear material, and then fragmentation, and there will be loss of membranes, so breakdown of plasma membrane organelles and nucleus, and leakage of the contents. So this will occur by necrosis. Okay, defined gangrene is a type of necrosis with a superadded putrefaction in living tissue caused by critically insufficient blood supply. So what is gangrene? Gangrene is a type of necrosis, macroscopic necrosis, in which there is superadded putrefaction in living tissue caused in living tissue by critically insufficient blood supply. What are the different types of necrosis and apoptosis? So okay, so what are the differences between necrosis and apoptosis? So in necrosis, the cell size enlarge, and apoptosis it shrink. Nucleus undergoes karyopeknosis, karyorexis, and karyolysis, and then here fragmentation into nucleosome-sized fragments. Disrupted membrane, yes. Intact altered structure, especially orientation of lipid. So in apoptosis, the membrane structure is integrated still, or the membrane persists, but the structure is a bit altered. And in in necrosis, the plasma membrane are disrupted fully. Cellular enzymatic digestion may leak out of the cell. Intact may release in apoptotic bodies. So this is released in controlled manner. The cell divides into apoptotic bodies. Adjacent inflammation frequent in necrosis? No. Physiological or pathological rule? Invariably pathological, culmination of irreversible cell injury. And apoptosis is sometimes physiological. Often physiological means of eliminating unwanted cell from the body, may be pathological after some form of cellular injury, especially DNA damage. What are the differences between dry and wet gangrene? So site most commonly occur in limbs. The dry gangrene and the wet gangrene commonly occurs in gut, bowels. Mechanism: arterial occlusion. Mechanism: venous congestion or venous obstruction. Microscopy: organ dry and shrunken and black. Pot: moist and moist, soft, swollen, and rotten and dark. Putrefaction: limited due to very little blood supply, marked due to stuffing of organ with blood. And line of demarcation present at the junction between healthy and gangrenous spot. No clear cut line of demarcation in wet gangrene. Bacteria fail to thrive. Bacteria numerous present. In wet gangrene, numerous bacteria present. Prognosis: generally better due to little septicemia, generally poor due to profound toxemia. Okay, so here we have, what do you think is the cause of ischemia? Atherosclerosis. Define atherosclerosis: it's a pathological process of the vasculature in which an artery wall thickens as a result of accumulation of fatty material such as cholesterol. So atherosclerosis is a pathological process in which the vasculature walls in which the vasculature walls, especially arteries, medium and large size arteries, walls thickens and lumen narrows because of the accumulation of fatty materials such as cholesterol. What are the risk factors of the atherosclerosis? So modifiable, non-modifiable. So modifiables are smoking, hypertension, obesity, high BMI, diabetes, dyslipidemia, lack of physical activity, stress, and excess alcohol consumption. Non-modifiables is old age, male sex, ethnicity, and genetic familial factors. Chest X-ray showed pleural plaques. What is pleural plaques? So this is the chest X-ray, and it shows the pleural plaques. Okay. Here you can see. So the most common manifestation of asbestos exposure are well circumscribed plaques of dense collagen. Well circumscribed plaques of dense collagen that are often calcified. What is the significance of pleural plaques? So, increased malignancy risk of mesothelioma and lung adenocarcinoma. Distal to gangrene, surrounding area shows redness. What is the pathological process? So, post-hypoxic vasodilation. What are the pathological cells present in atheroma? Contents of atheroma cells, foam cells, macrophages, and lymphocytes. Apart from hypertension, diabetes, and male sex, what are the other three major risk factors for atherosclerosis? Smoking, family history, and age and hyperlipidemia. Which size of and types of cells are mostly affected by atherosclerosis? Large size and medium size. Simple bedside investigation to detect bronchogenic carcinoma. Sputum for cytology. Sputum for cytology. Okay, give one classification of lung cancer. So we have non-small cell lung cancer and small cell lung carcinoma, oat cell carcinoma. So non-small cell carcinoma, these are share common features of prognosis. This is a group of lung cancer which share common features of prognosis and management. Paraneoplastic features and early disease dissemination are less likely than with the small cell lung carcinoma. They comprise the following: adenocarcinoma, 40% most common lung cancer type encountered in never smokers, and squamous cell carcinomas 25%, slower growing and are typically centrally located in never smoker is adenocarcinoma. Large cell carcinoma 10% cases, and small cell lung carcinoma or cell carcinoma, these are very aggressive tumors, disseminate early, and small cell lung carcinomas are comprised of cells with neuroendocrine differentiation. These arise from neuroendocrine cells of Kulchatsky. The neuroendocrine hormones may be released from these cells with a wide range of paraneoplastic association. These tumors are strongly associated with smoking and typically arise in larger airway. They disseminate early in the course of the disease, and although they are usually chemosensitive, this seldom results in long-lasting remission. So they are very aggressive and very poor prognosis cells. The paraneoplastic associated with them are ADH and ACTH. So they will cause SIADH, SIADH. Okay, and here squamous cell carcinoma also has one paraneoplastic which is PTH like peptide, PTH related peptides. So they will call hyperparathyroidism. Now the patient is presented with METS pole differentiation. How to tell its epithelial origin? Immunohistochemistry or FISH. Fluoro absorbent this hybridization. What is the gene responsible for lung cancer? Thyroid transcription factor. Thyroid TTF1 expressed in epithelial cells of the thyroid and lungs. TTF is useful as immunohistochemical marker for the diagnosis of lung cancer. If the tumor was epidermal growth factor positive, epidermal growth factor, what will be the chemotherapeutic agent? Tyrosine kinase inhibitor, imatinib and nilotinib, TKIs. So this is the diagrammatic presentation of the lung. So we have non-small cell lung, which is 85%, and these are the 10%. These are very aggressive, disseminate early in greater airways, and so here again 40% in never smokers, and this is 25% very slowly, and also occurs in smokers and centrally located. Large cell carcinoma, they are very 10% very rare. So second most common oral is the squamous cell carcinoma, but most common in smokers, begins in squamous cells in the bronchi and of the lungs, usually center of the lung, typically slow growing, and least common is the large cell, benign in large cells, found anywhere in the lungs, but mostly in the outer part, typically fast growing peripheral. Adenocarcinoma, most common oral, including in non-smokers, young adults and women, benign in glands in the alveoli, usually in outer part of the lung, typically slow growing. So these are some of the classification for the